How do we treat these patients? This is important, especially after today's talk. Make a diagnosis. Tell that patient, tell that parent that came in the office that day, your kid with belly pain and diarrhea and missing school has constipation. You know what it is. If you hedge, they are dissatisfied. Tell them about the history. Tell them about the exam. Tell them that you know, that you understand, that you can fix what they have. You'll go far. People need a positive diagnosis. Set expectations. Hit number 2. If you don't tell them that it's going to take a long time to fix, they will be despondent when the kid doesn't fix well. I see parents in the office, or I did in days gone by, and I'd say they're constipated. You've got to work on training and diet fluid. The mother would take off a week of work. That's it. I'm taking off a week of work. I'm going to fix this constipation next week. No, you're not. At the end of the week, they're no better. I encourage them, make them think of this in terms of a motor behavior. It's like learning baseball. Everybody thinks about sports. Imagine if your kid was trying to learn baseball. If you took a week off of work and you took them to the park every day and made them swing a bat, at the end of the week, they'd be better. They would not be a major league player. They would be better. Some people get better faster than others. I got good at baseball very slowly, which is why I'm here. I did not get very good at it very fast. But it is a motor behavior. They have to think about it like a motor behavior. Or piano for the kids that don't play sports. It takes a long time. If you practice piano wicked hard for a week, they're not a pianist at the end. You have to think in terms of months. If at first you don't succeed, you just keep trying. You keep lines of communication open. You call, you email, you see them back in the office. But they do get better. And you tell them all, not only do I know what you have, but I know your kid's going to get better. And what we're going to do here is come up with some things that are going to help your kid get better faster. And I know this because that's what Rufo said, and you can quote me on that. We use medicines, we use stool softeners, laxatives. You can use rectal agents like enemas, although in suppositories, although the kids aren't too juiced about this. Dietary changes, fluid and fiber. Very important. The more fluid, the more fiber the kid gets in their diet, the less you'll need the medications. I have a lot of parents right now who come to me and they say, Miralax, stool softeners. I don't want them on that. I want them on something else. I say, good, go give them a bowl of bran fiber every day. And they'll say, well, they won't do that, and the Miralax looks a whole lot better. I mean, fluid and fiber is what you want to do. Scheduled sitting times, very useful if you can get kids to buy into it. It's a little bit hard. Motivated parents, motivated kids maybe, but it's a tough one. What I do, and I find very useful, especially in boys, have them sit when they pee. They all stand. Boys train later than girls because we're less smart, less sophisticated. I have boys and girls. My girls train faster than my boys did. And you know, we hamper boys by trying to get them to do the two-skill thing. They have to learn peeing from a standing position, and they have to poop from a sitting position. It's two things, and the kids are already mentally disabled anyways because we're boys, so it's just too much. Make it easy for them. Do all of the training from a sitting position. It's very easy to pee from a standing position. I know, I do it all the time. Don't worry about that. Tell the parent, just train them from a sitting position. If they sit and relax the muscles to pee, stool that they didn't even know about might find its way out. And the nice thing about it is it's no extra trips to the bathroom. You just tell them to do it when they're at home. Not when they're at the park, not when they're at a friend's house, but when they're at home. It works like a charm. It is sometimes the deal breaker that makes kids get better, especially boys. Stool softeners, what do we use? Mostly Miralax, or PEG 3350. It's great. Odorless, colorless, tasteless. You dose up. The side effect is diarrhea. It is very safe. It doesn't cause seizures, although there was a big spurt of electronic media saying that PEG caused seizures. It doesn't. It just makes people have to go to the bathroom, and people anticipate that urge as a change. Mag citrate also works well. These are osmotic agents. Better for a clean out, but can be used. Mag hydroxide, which is milk of magnesia, has a taste to it, but it does come in chewables if you want to try it. Lactulose, non-absorbable sugar, also works well, but it ferments and causes gas, makes them feel uncomfortable. Mineral oil, old school, great. Probably, my view, the best agent to treat toddlers who withhold. You can withhold Miralax. You can withhold Dulcolax or X-Lax. You cannot withhold mineral oil. It always wins. So if you have a 2-year-old or a 3-year-old who's still in pull-up or diapers and withholds to beat the band, dose them up on mineral oil. 1 tablespoon a day. Mix it in food. It mixes well in ice cream. It mixes well in yogurt. It mixes well in pudding. You can put it in milk, chocolate or otherwise. Kids don't know that it's there, but it lubricates to a point where the kids can't do it. In your retentive patients who don't have a history of vomiting or aspiration risk, it is the bomb. It works really, really well. Stimulants, it's all center-based nowadays primarily. So X-Lax or Dulcolax, half square, full square, 1 tablet, 2 tablets. You dose it to effect. And glycerin suppositories acutely, especially for younger kids. The older kids, they don't like the rectal stuff so much. What to say with respect to behavioral management? Reward the behavior and not the outcome. If you only say attaboy when the kid makes a poop, the attaboys are just too infrequent. If they sit in the toilet when you ask them to, or sit in the toilet when they're peeing at home, give them the attaboy then. Eventually things will work out. You can close your eyes, hit a golf ball, and it'll go far, but most of the time it won't. So don't reward that behavior. Reward the right stance and all like that. Kids, you can't rely on kids to sit when they have to. That never works. If you say, I want to sit, if you tell a parent to have the kids sit on schedule or sit when they don't feel like they have to poop and they say they can't, you have to. The reason why they have accidents is because kids can't put it together in their head that they have to go. So at least in the short run, kids have to be cued on sitting. The rectal sensation is dissipated or decreased in these kids, so you have to understand that. Sitting on schedule helps. Involve psychologists if the kid won't sit. If a kid comes to my office and they said, I'm here for management of the constipation, what's the problem? He won't sit in the toilet. No amount of mineral oil is going to help with that. If they're phobic about the bathroom, that's a problem, not something I can necessarily help with. If there's oppositional behavior, sometimes it's just a bit of an iceberg. You have this frumpy kid in the office who's won't poop on the toilet, but he also won't eat vegetables, he also won't go to school, he also throws things. Much bigger issue, and obviously these people need help in regions other than my aisle of the supermarket.